And welcome back now. The first 80,000 doses of the Johnson Johnson AD26 Janssen's vaccine arrived in South Africa last night. Now, the jabs, which will be distributed to designated vaccination sites in all provinces, will be overseen by the Health Department and the South African Medical Research Council, or MRC. And as we've heard from healthcare workers and unions, most are in fact waiting in anticipation for these jabs. Now, the South African Medical Association, or SAMA, says that it is heartened by the arrival of the vaccines, and it's encouraging all frontline healthcare workers to register for the inoculation. And to discuss this further, we're joined by SAMA's vice-chairperson, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, thanks for your time. Welcome to Morning Live.
Good morning, Sakina, and good morning to your viewers. Thanks for having me in your show.
Dr. Mzukwa, let's just start with the arrival of the J&J vaccine. So a batch of 80,000 arrived in the country last night. And that, of course, not enough for all the healthcare workers just yet. We do know that there's an additional 500,000 doses to follow within the next few weeks. But what's going to happen right now with regard to the 80,000 doses that we do have?
Well, those vaccines will be taken to obviously the 16 or 17 sites that have been identified by the MRC. They'll be distributed to those areas. It will depend, first of all, on the number of trained personnel to give the vaccine. But secondly, it will also depend on the burden of the disease. So it will be really equal distribution across the 17 sites. And that is all being seen by or attended to by the Medical Research Council of South Africa.
So in that regard, can you just give us a little more clarity as to who is likely to receive this first batch of 80,000, even within the healthcare sector and with regard to frontline workers? Who exactly is likely to receive this?
Well, the understanding that we have, and according to the plan, is that we, in phase 1, it should be healthcare workers who are frontliners in terms of dealing with COVID-19. So we expect that to be distributed across the 17 sites, but also when it arrives there, it must the jab must be given to healthcare workers who are frontliners. I'm sure at the sites they will have a plan of how they do that according to the guidance that is there by the Medical Research Council.
So when the AstraZeneca vaccine first arrived on these shores, it was said that it would be quarantined. That whole consignment would essentially be in quarantine for a period of about 10 days. So we understand that's not the case with this J&J consignment. Can you explain to us why the difference in terms of how the process is rolled out?
Well, I think when it comes to, you mean the vaccines themselves or the people that are transporting?
The vaccine itself.
Oh, yes. Well, there was a plan in place already when it comes to the vaccines, that has been outlined. But you must remember that at this moment now, there is a plan which says that this is an implementation study. People will obviously it has to go through the SABRA. SABRA has to do what we call Section 21, process the Section 21 application. It takes time, but in the meantime, they can continue with the implementation. So the processes are rolling at taking place at the same time when the distribution is happening.
So just with regard...
That is our understanding.
So my apologies there to our viewers, Dr. Mzukwa, and to you, because that signal essentially just broke up and we lost you there for a little while. So in a nutshell, just again, very quickly, the J&J vaccine, we know it was trialed here, but of course, we're talking about how seemingly different this particular process is going to roll out as to the one that was anticipated to be followed with the AstraZeneca vaccine.
Well, what we understand is that the processes are not has been reviewed. What is going to happen now is that these vaccines will be coming in batches of 80, and 60, about 300,000 of them. Then thereafter there'll be a purchase depending on the availability of stock with J&J. But at the moment, the rollout will be happening in these sites, 17 sites, because in those areas there are research institutions that are in those areas. It's just that in the Northern Cape, I think there's only one. So those are the reasons why we're not having all the 1.2 million medical healthcare workers. But what we expect is that after this batch, another batch will follow, and that will be expanded to other healthcare workers, including the private sector. That is what we'll be holding government to, so that we understand what is happening on the ground. So we expect those to be done over a period of 2 weeks or more, and then thereafter the other batch will be coming, and it will be distributed accordingly.
So, Dr. Mzukwa,
that will be the phase one of this. You remember that we're still going to. This is going to be distributed to the whole public, but it has to be first the healthcare workers.
So let's just talk about that and the registration process, for example, where healthcare workers have to go and register on a particular site. So do you know how that has progressed? How many frontline workers, medical practitioners have actually registered? And also, what about those who choose not to take the vaccine and their rights, and how this is likely to impact? Will they, for example, be moved to other areas, or how is it going to work?
Well, Sakina, our understanding is that the registration by healthcare workers is very slow. There's about, it was about 28% on the 15th of February. People were registered on the site. This could be due to poor communication strategies that are employed by the Department of Health, but also sometimes not really engaging other stakeholders, because at times you've got to chase after the Department of Health wanting information, especially to reach out to healthcare workers. So that is one of the challenges that may be facing the Department of Health. But secondly, there might be issues of hesitance. Like you said, some people don't really they're not sure, some they don't want, but we remember that it was declared that it's not compulsory for healthcare workers to be taking this vaccine. But also I think the problem would be when you're distributing out vaccines or you want to give injections to people, you need to disclose and be transparent, not only for regarding advantages, but also the disadvantages in terms of your side effects. You know, if you choose the good things and ignore or even hide, the bad part of it, I think that's what the problem is. We know that any medicine has got side effects. There is no way that if you're going out to the public, you can only be talking about good things about the vaccine. We need to disclose, even have time for those healthcare workers who are really not wanting to take this vaccine, to explain. But in the meantime, we need to continue dishing out the vaccine whilst we engage the other healthcare workers who really are not into it.
Huge concern there if you say, as of the 15th of Feb, only 28% of healthcare workers registered. That means the majority of them haven't. And what does that then mean for the rollout program for these vaccines? But in addition to that, as you say, there is a need for more education. And perhaps we can talk, Dr. Mzukwa, about the difference between the Oxford AstraZeneca vaccine and the Johnson Johnson AD26 Janssen vaccine. The second one, we understand, is more effective against the South African variant, the 501Y.V2 variant. But what does this actually mean if you were to explain this in layman's terms? The J&J vaccine said to be around 57%, in efficacy. What does that mean? And what would be the ideal level of efficacy that one would want to see in a vaccine?
Well, if you look at the vaccine in the other countries, we would expect, honestly, to have a efficacy of around 95 to 100%. But anything above 80 is still acceptable. But 57%, you will remember that in the South African context, the South African variant, Johnson Johnson is the only vaccine that has gone above 50. All others have been below 50. So even though we have not achieved the desired outcomes, but at least we have a 57%, But the other challenge is that, as we know, that this study has not been peer-reviewed, obviously by other academics. But we take what we are told now, that it is about 57%, and it's better than the other vaccines, against the South African variant. I think the challenge that others had was the South African variant, which honestly they could not be effective.
But even 57% is a long way off from 80, even 95% efficacy. And this is part of what has people worried in this country with regard to the efficacy of the vaccines that we are receiving and that will be administered to the public. Do you believe, though, Dr. Mzukwa, that the studies have been large enough for us to have much confidence in the vaccine that we have now received?
Well, that is exactly what I was saying, Sakina, that the study has not been peer-reviewed, so it would be information that we're getting from the researchers themselves, but, no other confirmation from other peers. So it would be difficult to know exactly if the study was really satisfactory. We know that this was conducted in about 8 countries, including South Africa. So the challenge about that is that the study itself has not been peer-reviewed.
And then, of course, it raises questions about other vaccines, the Pfizer that you mentioned. How much do we know about that vaccine and how that might work, its efficacy against the South African variant, that 501Y.V2 variant?
Yeah, like I said earlier on, the Johnson Johnson is the only one in our South African context that has been studied and has been shown to be above 50. The others have fallen short of 50. So I think this was the highest that we could get against the South African one, the South African variant. But also I think the attraction with this was this one requires only one jab. The Johnson Johnson, even though it is said that in the future they might need to see if there's a need for a booster, but at the moment you need just about one jab. I think that was the attraction more than anything.
So just on a further point of clarity, so we have tested the Pfizer vaccine, obviously this J&J vaccine, then the AstraZeneca. Which others have we tested against our variant of the coronavirus?
Well, I don't have that knowledge at the moment. I think there's discussions about other like your Sputnik and stuff like that, but I'm not sure if there are arrangements to have them studied in the South African context. So I don't have that information, Sakina.
And just a final question, Dr. Mzukwa, price, that of course is a very sensitive subject for many South Africans. Are you able to talk to us about the price of this first batch and or even the overall total 900 million that was mentioned by the Minister of Health?
No, not at all. I don't have access to that information. I think they always talk about these confidentiality issues, but honestly, from our side, we don't have any information of how much it costs the country.
Dr. Mzukwa, we're going to leave it there. Thank you so much. That was South African Medical Association's vice-chairperson, Dr. Mvuyisi Mzukwa, who is talking to us there about the COVID-19 inoculations. This, of course, as the country has taken a receipt of the first Johnson Johnson vaccines and 80,000 batches. And we're expecting another 500,000 batches in the next few weeks. So that is some of, the discussion point. We're also asking you about this in our question of the day, so let us know what your views are. Does this make you any more optimistic about our vaccine rollout program? At Morning Live SABC is where you can get in touch on Twitter. But we're going to take a quick break before we bring you the news at 7.